Tonight, we're continuing our ongoing election series, bringing you conversations with the candidates of some of this area's biggest races. These are not debates, there's no arguing. Instead, each candidate is allowed to lay out what their policies are and what they would do with your vote. Please note these interviews have been edited down for time, but we do have the full versions available. Tonight, we head over to Iowa and the race for the 1st District. Democrat Christina Bohannan is challenging incumbent Republican Mariannette Miller-Meeks. We'll hear from both and begin with Bohannan, whose last name comes first alphabetically. It's part of Your Voice, Your Vote coverage here on News 8 at 6:30. Let's say you win on November 8th. What are the 3 or 4 most important topics at the top of your mind when you walk into Congress?
Yeah, absolutely. So, my priorities will always be determined by what I'm hearing from people in the district. They're not my priorities per se. I don't have an agenda that I bring into this. But as I've been going all over Southeast Iowa, I've been hearing from working families and what they're facing. And a lot of that has to do with costs, high costs of energy, gas, groceries, all of those kinds of things. And I see that certainly when I go to the grocery store as well. A few of the things I would want to work on are bringing costs down. We have to become more energy independent. We have to be able to control, our own access to fuel, and heating is going to be expensive this winter. Gas to put in our cars, we have to make sure that we're bringing those costs down. Also, healthcare. Huge issue, so things like bringing down prescription drug costs. Also, in general, our rural health care, we are seeing our small hospitals shut down in a lot of places. In Keokuk, it was just announced that the hospital there is going to close. We've seen a number of closures that way, all over this district. And we also see that the places that are operating are always having trouble finding physicians, nurses, staff, and so I would want to work on incentive programs to recruit very good healthcare workers and to keep them here. And also to keep our hospitals open, at least our emergency rooms. I think that when some of those hospitals shut down, we can at least, keep the emergency room for things like strokes and heart attacks and accidents that require immediate attention.
Turning to the economy, from Muscatine to Burlington over to Iowa City, what are ways that a congresswoman can help out when it comes to driving down inflation for people all over the 1st District?
First of all, we have to make sure that we move toward energy independence. I think that's so important. And so I did support, releasing a lot of barrels of oil from the Strategic Petroleum Reserve. I think that was a good step. Making ethanol year-round, I think, is a good step to bring down prices in the short term and help Iowa ethanol industry, so that's good. And then, beyond that, we also need to move toward renewable energy. Iowa will be great for this. We already get a huge amount of our electricity, more than just about any other state, from renewable fuels. So that can be a real growth industry for us and a place where we can add even more jobs. So this will be great for our economy while we're also helping to bring down those prices.
Attack ads have accused you of being soft on crime and being for defunding the police. Where do you stand on those issues?
These attack ads, politics have gotten so ugly, and they're just absolutely untrue. I totally support police and law enforcement. I think that's really critical. We have to give them good wages and benefits to recruit the best and the brightest. We have to give them the training and resources they need to do a really difficult job safely, and to keep our communities safe. And the other thing I think is really important is giving them some support, like, mental health professionals, social workers, because what I've heard from a lot of law enforcement is that they are called to deal with situations that aren't really violent, a homeless person or a mentally ill person. And what we need to do is make sure that there are professionals that can deal with those situations so that our police can get back to, dealing with violent crime, which is what they were really trained to do.